Good evening, everyone, and welcome to Managing Lyme Disease and Your Mental Health. I am Noah with Project Lyme, and I'm very excited to share our two featured speakers today. We have Christina Conzavelos, is that correct? Conzavelos?
Yeah, good.
And Michelle McKinsey, both of which are licensed social workers and therapists who I think will do a great job in helping us all to discuss how to uh, address unique mental health challenges that are obviously faced by individuals who live with Lyme and other tick-borne diseases. So I'll just do a brief intro. Christina, as I mentioned, is a licensed social worker, life coach, writer, and chronic illness warrior. She received a BA and Master's of Social Work from UCLA and her MLIS from San Jose State University. She has over 14 years of clinical experience and I think will be a great help for us this evening. We also have Michelle McKinsey, who is a licensed social worker and a CIMHP, and she offers online therapy for adolescents, adults who experience mood issues and problems adjusting to chronic illness. And she's able to help those who live in North Carolina, Tennessee, and Florida. But obviously, this evening, if you're not from any of those three states, she'll be happy to address any questions that you may have. And again, just a brief recap of who I am and Project Lyme. I'm the executive director of Project Lyme, which is a 501c3 nonprofit whose mission is to eradicate the epidemic of tick-borne disease. We do a variety of programs in education, research, advocacy, and patient support. So I want to obviously open up today's conversation by briefly asking the both of you, and Michelle, I'll start with you. What is one of the main mental health issues that you see from your Lyme or tick-borne disease patients?
I certainly see a lot of depression, a lot of anxiety, panic in particular. And, we see very high rates of suicidality among Lyme patients. So, stemming from that depression and, that anxiety that feels just so overwhelming, I think. So those are the things that I see the most. With other co-infections, you may see things like psychosis, seeing things that aren't there, hearing things that aren't there, feeling like things are true that are not true, rage, anger, so you see really just a wide range of mental health symptoms presenting with tick-borne diseases.
And Christina, is there anything that you might add to that that maybe you're seeing slightly different or can just reinforce Michelle's thoughts?
Thing I see most of is actually medical PTSD from being sick and not getting properly diagnosed and going through so much in order to just be believed and taken seriously. And so there's that coupled with everything else, the anxiety, the depression. I mean, we have to think Lyme in and of itself has over 300 symptoms. 20 to 40% of those are neuropsychiatric. So there's a range of symptoms surrounding that. But yeah, anxiety, depression, as she mentioned, suicidality, suicidal just ideation in general is really big.
Yeah, it's definitely something that I hear about as well. And obviously, neuropsychiatric Lyme, it causes a lot of those symptoms in patients. And Christina, to your point, just the general state of tick-borne disease care and understanding among the general public can obviously lead to some of those factors as well. So another question that I have, again, is going to be for the both of you, is what are some general misconceptions about therapy? The main reason I asked that question is obviously we have 38 participants who are here at the moment that have taken the time to express interest in therapy, but there's a lot of people who might be rewatching this webinar down the line that maybe have never considered it or even thought of it as an option to help address some of the issues that they're going with. So just wanted to again, common misconceptions about therapy that maybe you see either with new clients coming in or things along those lines. And I'll flip it this time, Christina, I will start with you.
Yeah, so I find that the mental health component is vital, and that's because we do not get sick without being in a chronic stress response to begin with, which affects our immune system, which affects our autonomic nervous system. So if we're not addressing the root cause of dysregulation in a person's nervous system and body, a lot of things are going to get missed. So what I mean by that is, I always use this as an example. When we've been stuck in fight or flight, often from a young age or later on, various traumas, our brain is perceiving there is a tiger essentially chasing us at all times. So we know this as fight or flight, but we forget about a fawning response and we forget about a freezing response. Fawning, people pleasing, codependency, type A personality, putting everyone else first, being the overachiever, these sorts of personality traits that keep us on this hamster wheel of running away from this tiger. And if there's a tiger behind us, our body is always going to prioritize survival over healing. And when survival is at the forefront and you're throwing supplements and treatments and this or that, sometimes they're not going to be completely absorbed. Things are not going to be, the efficacy rate isn't going to be as high when we're in this chronic dysregulated state. So what therapy does is gets us into a more regulated state. It gets us away from that tiger. It has us finally believe maybe the tiger was there at different points in our life. It's not there right now. Our bodies can relax. Healing can come off the back burner onto the front burner, and we're going to see these other therapies really, really, really start to work. And so often when people come to me, they feel like they've tried everything, but they have not tried this. So getting them into a regulated state is number one. And then we get to start really addressing the roots of the dis-ease in the body, the various traumas and so forth, so that their body can truly irrigate it and heal and feel better.
And Michelle, did you want to build on that at all?
Yeah. I absolutely agree with Christina. And I think also it's important to recognize that, the stressors not only create that dis-ease that Christina referenced, but the disease, Lyme, tick-borne diseases, also create increased stress responses in the body. It creates inflammation in the brain. It affects our white matter, our amygdala. So it's crossing the blood-brain barrier. It's aggravating these symptoms that maybe we're already experiencing. So we're kind of in this like catch-22 of dealing with the trauma and the stressors and dealing with what the disease is doing. So there's such a strong connection between the mind and the body. And so it's just so crucial to address both aspects of healing. I don't think we can really heal without addressing both of those things, without doing them both. And so recognizing that, we can influence the physical symptoms that we're experiencing, that we can control our breath, that we can slow down our heart rate, that we can even reduce inflammation in our body by lowering our stress levels. So it's all just so interconnected and really important. And I think some people come or are against therapy maybe in the beginning because they think, oh, talking about it's not going to help. I hear that sometimes, but they don't really realize how important being able to express what they're experiencing, saying those things out loud and being able to kind of process the different things that they've experienced, whether it's childhood trauma or earlier life trauma, whether it's the gaslighting that happens during this illness process. And it's about figuring out, how do I live my life differently from this point on? How do I stop this cycle of stress and disease from happening?
So one more piece of kind of background information that I want to gather from the both of you before we jump into some of the approaches that you take with patients is relationships and relationships that patients might have with other people in their lives, whether it's their family, if they have somebody who's a caregiver. And Michelle, I'll start with you. Can you just talk a little bit about how relationships can influence a patient's mental health as well?
Yeah, relationships are so important. Sometimes we have negative, unhealthy relationships already in our life that are creating stress and leading into that cycle that we were just talking about. So sometimes when we're dealing with illness, it's a chance to recognize when those relationships aren't healthy and when we need to maybe break free from those relationships, where we need to set boundaries so that we can reduce stress, so that we can focus on our healing. When we're surrounded by people who are loving and supportive and empathetic, who try to understand what we're going through, who walk alongside us in this journey, that creates essentially an energy that we absorb that influences healing. People who are surrounded by supportive, loving family members, friends, a healthcare team even, have better health outcomes than people who feel isolated or alone or have those unhealthy, toxic relationships in their life.
And Christina, can you elaborate as well from your perspective? Obviously, we know
Yeah,
family is
sure.
important to you.
Yeah. Hi, mom and dad. No, yeah, I agree. I agree with everything Michelle said. Just a few more things. Like, we truly heal in community. We are meant to co-regulate and heal. This is why, being a part of a group that feels good on your nervous system can be so impactful, like a support group of some kind, or just joining groups in general, having those kind of connections and interactions on a regular basis. And I really do believe that we start to heal when we are believed, when we are like actually truly listened to and believed, like by our providers, by our family, by our friends. Because so often, like Michelle said, like there's a lot of gaslighting that happens, not even just with medical providers, but within our family systems, within our friends. Like, are you sure you're really that sick? But you were feeling good yesterday. I don't understand. Like, why? How could you be so tired and fatigued today? Those are things to keep in mind. And also, this is totally Dr. Gabor Mate's work, but the body finally starts to say no for us. That's often why we get sick. And I've noticed that getting sick is an invitation to get healthy in all ways, in all areas of our life. And that includes creating boundaries, saying no before our body has to. So often I see a lot of people pleasing, fawning in this realm. So being able to say no when something does not feel right, when something is not alignment, is so empowering and huge. And that includes within the dynamics of our families, with our partners, with anyone else, our work, et cetera, et cetera. So it's this balancing act that we are invited into.
Thank you both for providing such a nice background as to, the experiences of patients and maybe what they might be seeing that could cause them to need mental health help. And so to move forward with this conversation, I'm curious, and Michelle, I'll bring it back to you again. What is the first thing that you're doing when a patient is coming into your office and saying, I need help?
The first thing I do, I really do try to get a very comprehensive understanding of where this person's coming from. So what's their medical journey, their health journey look like up to this point? What are the stressors in their life currently, as well as in the past? What are traumas or stressors that they've been throughout their life? I also take an integrated medicine approach to mental health, and I look at nutrition and lifestyle and current coping strategies, stress management strategies, self-care, all of these things impact healing. And so, looking at all of those factors and putting together a really comprehensive plan going forward, something that complements what they're already doing, maybe with their medical provider, but kind of fills in those gaps in the mental, emotional, and spiritual aspects of healing.
And Christina, I would love for you to expand on that and also maybe talk about how you can tell if the therapist is going to be a good fit, through this introductory kind of conversation.
Sure. So I personally, and maybe Michelle's like this too, I require that there is a consultation where I'm meeting for someone, usually for around an hour, sometimes more, to just get to know where they're at, so that we both can decide if I am a good fit for them and vice versa. Because not everyone is a good fit for me. I'm not a great fit for everyone, and that's okay. And I'll be the first person to send a prospective client to another therapist if I know they are going to be a better fit and more helpful to them. So I think, this is my rule of thumb, even for myself as someone who's still healing from Lyme disease and chronic illness, is, how does your nervous system feel when you're with this person in front of you? Do you feel, upregulated, dysregulated? Do you feel a calmness in your system? And I mean, I go with that when I'm meeting with them, and it's both ways. So often, I'll hear us both say, like, I think you'd be a really good fit. And like, I feel really comfortable talking to you. Usually I don't, those are sometimes that's like the feedback I'll hear. And then in terms of working with someone, I really have to start where they're at. Everyone is so very different. Everyone has been on different journeys. Some people have been in actual mental health care for years and years and years. Others have never touched it in their lives. So ultimately, first things first is we are going to start doing nervous system work, and we're going to work on our rapport together, getting comfortable. I'm not going to dig into traumas immediately because that's dysregulating. We're going to go low and slow, which is the recommended thing for for all things healing from Lyme disease, low and slow. And eventually we will head towards irrigating dis-ease and traumas. And like Michelle, I take an integrative mind, body, spirit approach. And it's important to look at all areas and facets of a person's life because everything impacts the mind, body, and spirit.
Mhm.
So I think you both did a great job in identifying that obviously individuals are going to have to be honest with themselves about how they're feeling. They're going to have to dig into and be conversational about some things that might be hard to talk about if they're hoping to achieve any sort of progress. But I was curious, and Christina, I'll bring it right back to you, is specific resources that you might share, books, or is it, are there supplements that you also use? Like what can a patient expect when they're either working with you or another therapist that's in the space as to help them along their journey?
So I can't speak to other therapists because I've been told I work quite differently than most therapists.
Okay.
But when I have a consultation with someone, I am giving them a long list of resources. I have on my website an actual resources page that has a section laid out for nutrition, neural retraining, all the books I recommend, podcasts, retreat centers. I mean, literally everything on there. And again, this is person to person dependent. Like,
Sure.
are they starting from scratch? Do they need a provider? What do they know about their environment? What do they know about their detox pathways? I don't know where each person is starting, but I'm going to meet them wherever they are and gently move forward with them with the resources I have collected over the many years since really I've been sick and needed to collect them for myself.
And Michelle, what is your approach?
Yeah, so I have a lot of kind of like Christina, a lot of resources that I've collected over the years of trying to get myself well and then turning to helping other people get well. So not necessarily specific books or web pages. I love Dr. Rawls' work, so I follow him a lot because he dives into a lot of mental health. So that's always a great resource. But I have a lot of handouts that I've created myself, things on detox, on nutrition, on herbs and supplements that can help with managing mental health symptoms related to Lyme disease. So I think it's a very individualized approach in looking at what each person needs, whether it's worksheets that can help them process their emotions, connect their thoughts to their emotions. There's a few apps that I do recommend for things like mindfulness and meditation. Your typicals like Calm and Headspace that have free versions that so many people love. Those are all really great resources. So I'm always giving out resources. It seems like I'm like, oh, I have something for that. So if you ask me, I probably can find it for you.
Well, having chatted with many doctors over the years, I hear kind of that as an underlying theme, is that each, especially with tick-borne disease, individuals are all going to have their own individual experience, their individual needs. Obviously, with tick-borne disease impacting so many different facets of your physical body, Obviously, I feel like that's going to overlap and impact different facets of your mental capacity as well. So thank you both for sharing some of those insights and tips. I actually have a couple of Q&As that's already been dropped into the chat, and to the 45 people that we now have in the webinar, if there's any other questions that come up that you think either of these two women might be able to assist with or at least help guide with, please feel free to drop them in the Q&A section. I do want to be very clear that we can't give any direct medical advice, but if there's anything, along the side of what this individual dropped, I think it would be helpful for you to do so. So I'll start with this one. It said, I heard you both mention the mental health side effects of Lyme disease, one symptom being brain fog, making you question, your reality. Do you see a lot of depersonalization or multiple personality disorder in tick-borne disease patients? And I'll open it up to both of you. I don't know if either of you has more of a specialty or experience with that. So I'll just open it up real quick.
So I certainly see brain fog and depersonalization. I think oftentimes the depersonalization is typically related to some sort of past trauma. So when I see that depersonalization occurring, I am going to ask the person, where are you at in treatment? What are you doing? What labs have you had done? Because certain tick-borne diseases are more likely to cause depersonalization than others. So that, I want to address that medical piece and making sure they're getting the healthcare treatment that they need. But then I want to also try to assess trauma if we haven't done that already, and if we're not already working on trauma, then encouraging the person to start looking at that and making those connections, and we can do that in a very, very gentle kind of way. I often use the analogy of a pool. We don't have to push you into the deep end of trauma, and go head first, but we can get in the shallow end of the pool and slowly make our way in as it's comfortable. As far as multiple personality disorder, I personally don't see a lot of that. I've maybe encountered it once in the 12 years that I've been a therapist. So that's not something I see a whole lot.
And definitely not as a direct result of tick-borne disease either. It's something I'm not a therapist myself, but from having many, many conversations with experts in the space, definitely depersonalization, potentially not even remembering people's names or there's that type of impact, but definitely not multiple personality as a result of tick-borne disease. Christina, did you have anything to add to that question?
No, I think the same. In all of my years of work, I've only seen one multiple personality disorder case, and it wasn't, as far as I know, I was working in a hospital, and it wasn't related to Lyme disease. But depersonalization, derealization, I've yet to not see it be related to trauma at this point. So as we start to do this work, hopefully that symptom starts to also calm down. That's because I also had it for many, many years, and I don't anymore. So it is possible to heal from so much of this. And the other thing I want to say is there is no one size fits all approach. It's it is so personal. Yeah.
Thank you both. I see a couple questions in here that I will be able to quickly respond to. The first is, will I be sharing the information of the two therapists after the call? This session is being recorded, and I will send a recording out tomorrow morning. It will be on our YouTube page and our website, and I'll also include website links for the two, both Michelle and Christina, who are participating here tonight, in case you wanted to go to their websites and learn more about them specifically. I do know they might be limited as to locationally where they can assist you, as I expressed earlier, but definitely will share the information. And then one other question that I saw is, yes, Michelle.
I just want to throw in there, in addition to my therapy services, I offer coaching services, which is open to anybody, anywhere. So that's one of the beauties of being able to do coaching.
Very cool. Thank you for sharing that information. And then one additional question that I had seen was, how can somebody access providers I do want to make it very clear that this is not an all-encompassing list, but Project Lyme has been working for many years with partners in the space, both patients and other nonprofits, to develop an as encompassing provider search as we possibly can. It includes doctors that range the gambit of treatment modalities, from naturopaths to integrative physicians to just general practitioners, but it does also include therapists. There's a way where you can go onto here, you enter your zip code, and then once you get through, you can actually filter by provider type. So if you're trying to see if there's any known Lyme specific therapists in your area, this might be a helpful way to do it. So again, I want to make it very clear. It's not all encompassing. There could be people that are, of that aren't on here. If that's true, please send it to me at info@projectlyme.org, because that's how we keep this provider search as up to date as we possibly can. As of now, we have over 500 providers across the country listed, but obviously we want to increase that if possible. I do believe both Michelle and Christina are listed on there. So, we try to get as many people as possible. So thank you for asking that question. And, we don't directly endorse anybody, just as a quick disclaimer, but definitely hope that you can find information that'll be helpful for you there. So to jump back to specific questions, I had one individual here share that her son is in an emotional crisis at the moment, and that she was just curious how she can support him without being physically present, because either she's not near enough to him at the moment to be able to do something, or there's any reason along those lines. And I'm curious your initial thoughts, and I'll leave that open as well. Feel free to jump in as you wish.
Yeah, so in crisis, I mean, so there's the mental health crisis line is what I would use. And if you're going to call them, to ensure that they understand that this is Lyme disease, and be able to just give them as much information as possible. You want to protect him, you want to protect yourself at this point. And I want to make that really, really clear. If you feel like your life or his life is at all in danger, definitely use the mental health crisis line.
Thank you. Yeah, I think that's a great response. Michelle, sorry, go ahead.
No, that's fine. I was just going to agree with Christina, making sure that that he has access to those crisis numbers. There may be a mobile crisis unit in his area that could respond in person, and provide him some in-person support if he needs it. And then certainly just staying in touch with him, checking in on him, texting, phone calls, those kinds of things, just to know that he is supported, just to be a listening ear to him as he needs it.
Yeah, I think unfortunately there's not a lot that can be done in those type of situations aside from reaching out. Like you're not going to be able to fly in from North Carolina to go assist with this situation. But what and the purpose of this session is to try to encourage more people to take the therapy route before they reach kind of that level of emotional crisis and state. Hopefully if you can do the work as you recognize that, okay, maybe I am starting to develop some mental health issues as a result of my tick-borne disease, you can preempt any major issues and hopefully, find health again. So one other question I saw come in is related to mycotoxin. Basically, do either of you work with people who have mycotoxins? And it seems like both are shaking your head yes. Michelle, maybe I'll bring it back to you again.
Yeah, I do. It's an area that I'm learning more and more about, but I've had personal experience with it. And so I've been learning about it a lot over the last few years. And honestly, I've had so many clients come in with both tick-borne disease and mycotoxin illness, as mast cell activation, EMF sensitivity. I mean, you just kind of see the whole 9 yards. So you almost can't not have some awareness about it. A lot of the symptoms do overlap. It can cause mental health symptoms as well. So it's a challenge, but it is something that I have some experience with.
So moving on, Maureen, I just wanted to do a quick shout out. She's one of the people who just put in a question. Her beautiful son, Rylan, we filmed a public service announcement with him earlier this year, which has been airing across the country. He, obviously was impacted by tick-borne disease and did a great job with the public service announcement at helping to advocate for children. So she has a question that I believe we did briefly cover, but I think she came in a little bit late. She is saying, can you briefly touch again upon trauma associated with patients and caregivers and treatments aimed at PTSD, whether that's talk therapy or EMDR or something else? Thank you. And I'll leave that open. I don't know who's more.
Yeah. Well, I really want to just really quickly go back to the mycotoxins. I didn't get to make a mention of it, but
Sure.
Mycotoxins can cause neuroinflammation. So inflammation of the brain, which then impacts our mental health and our autonomic nervous system. So I just want to make mention of that. And also going back, because this is related to this question of the mom who mentioned her son who's in crisis, that if you're a parent here listening, please, please, please also get support for yourself. It is absolutely vital because this is hard. It's really hard. It's to watch your child go through this, and you are not meant to do this alone. So as you're searching for support and help for your child, please do the same for yourself so that you're pouring from a full cup, not an empty one. And as far as treatment for post-traumatic stress disorder, and in the very beginning I mentioned the thing I see most of is often medical PTSD that people have picked up from this ongoing experience. And before, and I saw a question about DNRS, so like that's a requirement for me that you complete a neural retraining program if you want to work with me as a client to get your nervous system in a flexible state. We want it in a flexible state, so that we can then start to use things like EMDR and brain spotting and other modalities that are trauma informed, because it's imperative. We're dealing with a traumatic ongoing situation, so you need to work with someone who's trauma informed and hopefully chronic illness informed.
Mm-hmm.
Michelle, do you have anything to add to that?
Yeah, just to say that I've done a ton of trauma work. Even before I got sick with Lyme and got into this world, I was doing trauma work with my clients. And so now, yeah, like Christina, seeing a lot of medical PTSD, also a lot of just childhood and earlier adult traumas that are resurfacing or exacerbated because of illness. I typically use a model called cognitive processing therapy, which is based in CBT, cognitive behavioral therapy, but it looks at how our core beliefs have changed because of our trauma, how we've over accommodated and exaggerated those beliefs to say things like, I'll never trust doctors again, or I'm never gonna be anywhere around mold, which is really, really hard thing to do. And so kind of reframing those beliefs and processing through and making those beliefs more balanced so that the trauma is integrated as part of their life story rather than this big horrible thing that can't really deal with.
Thank you. And Michelle, while I'm on you, somebody specifically asked if you would be willing to share your resource on detox pathways and nutrition. I don't know if you have a webpage and or a download that you could share, but if you send it to me or put it in the chat, I'd be happy to include it in the recap email that comes out tomorrow.
Yeah, I have those in PDF. I don't have them linked on my website right now, but I'll be happy to send them to you, Noah, and you can share those.
Sure. Thank you.
I put it in the chat, my resources list, and there is a whole section on detox pathways and nutrition. So that's also listed.
Awesome. Thank you. I did see that in there, and I will definitely include that in the email for tomorrow. Christina, coming back to you, one of the questions that was put in here, and I just want to share with everyone, we only have about 10 minutes left, so I might not be able to get to all of your questions. But Christina, somebody asked if you see a lot of addiction issues with tick-borne disease patients, whether that's drugs or alcohol as a coping mechanism.
Definitely. yeah, when it comes to self-medicating, you know, as an example, someone who's having a lot of like throat issues, I see a lot of alcohol use because they believe that it helps with that symptom specifically, or just in general, just coping with the stress and the anxiety of moving through chronic illness. It's not uncommon, and I want to bring that up. This is a coping mechanism. It's a survival response. I see alcoholism and drug use as a survival response, which might be different than how other folks may view it. Also, you know, people pleasing, I also see as its own addiction. I see various forms of quote unquote addictions because people are just trying to self-regulate and find some peace, some regulation, some solace in the midst of what feels very chaotic and stressful and scary.
And Michelle, did you have anything to add to that?
No, I agree with Christina. I do see all forms of addiction. I'm not a substance abuse certified therapist, but we can't help but deal with different forms of addiction in our practices. And so addressing those as, you know, the unhealthy coping strategies that they are, getting at what the root need or desire is, you know, that, as Christina said, that that survival need that's there. And also identifying if it's an escape or avoidance measure to not deal with other stressors that might be happening in their life, a way to feel better, as she said. So. Mm.
Awesome. Thank you. I see Kate Nagel from Limelight Foundation is here, and she just dropped a question into the chat. She said, I often speak with parents of Lyme patients who need inpatient treatment. How can they best advocate for a child that needs Lyme treatment and a psychiatric inpatient unit and avoid CPS involvement or Munchausen by proxy label? This can be so traumatizing. And I know even through Project Lyme, I've met and assisted a couple of people who have had to deal with Munchausen by proxy. So curious, maybe Christina, we can start with you again, if you have any experience or recommendations there.
Yeah, I think finding literate physicians who are on your side to be in constant communication is really, really big, so that, you know, they can be advocating for you, for your child, providing information and research. We know that not enough doctors even believe Lyme disease is real. So I see these things, unfortunately, more often than I'd like to. So this is why it's so impactful to form a treatment team who's on your side and can step in and advocate if and when necessary.
And Michelle, did you have anything to add to that?
Yeah, just working with your child's doctor. Hopefully it's a Lyme literate doctor that you're working with. Any other Lyme literate healthcare providers, whether it's therapists or patient advocates that maybe you're working with, bringing that research, that information to the hospital, and just helping them understand as much as possible what your child is experiencing.
Awesome. Thank you. And Rachel, I see you put in two separate questions here. I'm going to ask them both to see it, just in the interest of time, if we can address both. The first thing that she said was she's very happy with her current therapist, but they don't really get the whole Lyme disease thing and how it affects her. Any tips for that? And then secondly, she said that realistically, her mental health symptoms started showing before any physical ones. And she's finding that, you know, sometimes it's connected and, you know, with her anxiety. And is she correct? So I'll put that, Michelle, back out to you. I know it's two questions, so if you need me to recap anything, please let me know.
Yeah, there was a little bit of a breakup in the first question, so I didn't quite catch everything.
Okay.
If you can keep going.
She has a therapist, but they don't really understand Lyme. How can she handle it?
Okay. So one thing that I do is I offer consultations with other therapists. So if there's a patient who, you know, has this kind of situation, I'd be happy to consult with the other therapists to educate them, to help them understand, particularly the mental health implications of Lyme disease. So that's something that could be available. But much like with the last question of the inpatient hospitalization, bringing that research to the therapist, sharing websites with them where they can go and learn some things on their own, maybe even a letter from their Lyme literate doctor that they're working with. Things like that can be really helpful to inform the therapist as much as possible. And I'm sorry, what was the second question?
And the second
Oh,
question was basically, is she correct in saying that sometimes the mental health symptoms show before physical ones?
Yeah, absolutely. And in fact, that was the case with me. I was suffering from depression. I started having anxiety and panic that was coming out of the blue for no reason. And then I actually got bit by a tick probably for the second time. We don't really know when the first one happened. And that's when I got really sick and everything kind of, all the dots were connected. So a lot of times I see patients coming into my practice that say, oh, I don't have tick-borne disease. I have, a history of bipolar disorder or depression, and and they want to work with me. And as we go through, we start to see, oh, there's these other physical symptoms that are present too that maybe have been overlooked or dismissed as one thing or another. But let's connect these dots. Let's do this testing and see what's really going on. And oftentimes we're correct, and they do actually have tick-borne disease.
Christina, did you have anything to add there?
Yeah, so for the first question, just echoing the same, I offer consultations to therapists and providers. I spoke to a provider yesterday who's like, hey, I have a lot of mast cell patients. What does this mean? Can you please explain more? And oh God, it's like a breath of fresh air. And I think Michelle probably agrees, like when someone can put their ego aside and go, I don't know a lot about this. You seem to be an expert, more so an expert in this. Can you please educate me? And yeah, it's just very refreshing. But also just having them do the research, because I know when I was really sick and with a therapist who knew nothing about Lyme or chronic illness, I spent half our session giving subtitles, and it was exhausting to do that emotional labor. And I think it's important to have that kind of feedback with your therapist or provider and sharing that with them. Like, I'd love for you to do, I'm going to give you these resources. I'd love for you to look at them and check them out. And, it's to their benefit if they were to consult with someone like Michelle or I to better help you and other clients that they're meeting with. And then the second question, so sorry, was around, the mental health piece. We still don't know when I was bit by a tick or how that happened, or if it was Bartonella or if it was Lyme first, but I had anxiety and panic disorder by junior high, like debilitating. And that came first before then, like my thyroid and celiac disease and all of the other things. It was decades before I was actually formally properly diagnosed, but it definitely started with mental health. Mm-hmm. And like Michelle said, I've yet to have someone step into my practice who comes to me who has strange symptoms or just mental health really, who has not been diagnosed with Lyme thus far.
Mm-hmm. Mm-hmm. Yeah. And I'll say too, I've been in remission now for 5 years, and I really don't struggle with any sort of mental health issues. Things I had since, my early childhood, early teens even are totally gone now. So, I mean, it's just kind of further proof how connected Lyme and mental health really are. When you can cure the illness, then you can cure the mental health symptoms.
100%. I'm walking proof of that as well. And if you guys walk away from this with one thing in your hearts, it's that you have the capability to heal from this.
Absolutely. Yeah.
So I have one more question from Krista. She put it in the chat, but also it emailed me. So I just want to make sure that gets answered before we call it for today. She was asking if you could talk about the importance of B12 and mental health. She said for her, she had very low B12, and that treating it basically made her mental health symptoms go away. Have either of you seen that same experience with your patient populations? Michelle, we can start with you.
Yeah, B vitamins, B12 in particular, is so important for your neurological health. So when we say neurological, we're talking not only your nerves and your motor function, but also your brain functioning as well. So it's going to have an impact on your mental health. And we also can't overlook the role of MTHFR mutation. And when you have that mutation, then your body is not metabolizing and using your B vitamins and your folate the way that it needs to. And in that process, it's a complicated process, but in that process, neurotransmitters are essentially created. And our neurotransmitters are the things that make us feel happy or sad or feel motivated or all of these things. So it's the B vitamins are crucial, and so that's definitely an area that that I'm looking at as I'm assessing nutrition with that patient.
And Christina, anything that you'd like to add there?
The same, and it's very rare that I don't see either a heterozygous or homozygous mutation of MTHFR. So it's the moment someone starts taking specifically methyl B12, we start to notice a difference, and in their energy overall, in their brain fog. There's so much that this is a really important piece when it comes to nutrigenomics. It's really important.
Well, Krista, thank you for asking that question. So we just made sure to address it before everything ended for this evening. I really appreciate Michelle and Christina, both of your time and all of your insight. I'm hoping that the patients that participated this evening took a lot away from it. As I shared, this is being recorded, and I will send around the recording as well as the links and resources that both of these wonderful women will be sharing with me via email. And I hope everybody has a great rest of your day. Thanks again.
Thank you so much.
All right. Bye-bye.